You've got a new ally in your breast cancer journey. A 70-gene profile test that, when used in conjunction with clinical information, will give you and your doctor results about your risk for breast cancer distant metastasis. Are you low risk or high risk of recurrence? When looking at clinical factors alone, a breast cancer patient may appear to have an aggressive tumor with a high risk of recurrence, which indicates a potential need for chemotherapy treatment. However, with MAprint, the laboratory can look directly at a tumor's genomic profile. The same patient that was assessed clinically as high risk could be genomically low risk by MAprint. Only MAprint was developed studying the entire human genome, which consists of over 25,000 genes, and identified the top 70 genes that were most predictive in determining a breast cancer's chance for distant recurrence. MAprint gives binary results, low risk or high risk of disease recurrence. Unlike other tests with fewer genes, like the Oncotype DX21 gene test, which results in an intermediate test result 39 to 67% of the time, providing little guidance in treatment decisions. MAprint is currently the only genomic test for breast cancer recurrence that is US FDA cleared for use in women of all ages and has been extensively validated in a prospective randomized clinical trial, providing the highest level of medical evidence. As seen in MIND-ACT, 3 out of 4 women with the most common type of early-stage invasive breast cancer were identified as low risk by MAprint, with no significant benefit of adding chemotherapy, potentially sparing thousands of women from unnecessary treatment. MAprint, currently the only test of its kind with all of the following: only low-risk or high-risk results, no intermediates, indicated for use in women of all ages, recommended by many independent clinical guidelines, plus it's reimbursed by most major insurance carriers. MAprint, know your risk. Ask your doctor if MAprint is right for you. MAprint, the clarity you need when it matters most.